If you have irregular cycles and want to know how to figure out when you're ovulating, keep listening. Most commonly, people rely on apps on their phone, which is great, but an app is just math. So if you have irregular cycles, a lot of times it's not very accurate at pinpointing when your ovulation window or even your fertile window is. You've probably also heard about OPK tests or ovulation predictor kits, but these measure for the amount of luteinizing hormone in your cycle, and when they show you that you have a peak, theoretically, that should mean that that is right around the time that you are ovulating. There's also a lot of new wearable technology out there that can track things like basal body temperature to keep track of where you are in your cycle. And theoretically, what should happen after you ovulate is there should be a big spike in your temperature, which should show that you ovulated. So maybe you're already using all of these things and you still cannot figure out when your fertile window is. None of it makes sense. And you're looking at all of this data and you cannot discern when you're ovulating. What do you do now? If your cycles are irregular, it can be really difficult to use any of these things as a way to determine when you're ovulating. So there are some things that you should monitor within your own body as well that can be helpful. One of them is that around your ovulation window, you should experience an increase in your libido. You should also experience a change in your cervical fluid. When you are close to ovulation, your cervical fluid becomes slippery and stretchy, like raw egg white, because that is what allows the sperm to get where it needs to go. You also may notice things like an increase in energy. And some people have something called Mittelschmerz, which is a little bit of pinching pain or mild cramping that happens right around the time that you ovulate. Honestly, for most people, it's probably ideal to use multiple methods to determine ovulation. So go ahead, use an Oura Ring, use the OPK strips, but also keep track of the physical symptoms that your body is giving you that tell you, hey, I might be fertile today. Ideally, what will happen is as you start to notice the symptoms, the patterns, the trends that happen within your own body, you can verify those results by doing something like an OPK test so that you know that what you're noticing is accurate and it's your body telling you that you are fertile. You also can bring all of that data to someone like me. It is my job to help you understand what's going on in your body and help you decipher all of these things so that you don't have to miss another month of fertility.